seeing older patients in clinic, especially with aggressive lymphomas, it's hard for me because aggressive lymphomas are curable, okay? And in incurable diseases, it's easier for me to tone back, the aggressiveness of my therapy. But in curable therapies, as a clinician and clearly with informed consent, I'm more willing to risk, and I think patients are too. So, busy clinic, you're seeing 20 patients in the community, even more. I find sometimes the frailty assessments and all those things, like you don't have time to do them. And it ends up being so how do you kind of approach that in the clinic? Let's just give an example of someone in their mid 70s who has relapsed DLBC, large cell lymphoma, an aggressive lymphoma that is coming to you for CAR T, and they're kind of borderline, So how do you approach that?
That is such a great question, Dr. Goodman. I struggle with it. I do. And I tell patients honestly. So I conduct at the initial visit a geriatric assessment. With initial visits, I get an hour, and that's where I do that. And any sort of follow-up questions or other assessments, I can always send them additional questions through the portal. Afterwards, I talk to them realistically about the side effects and what their goals of care are. So I always make sure it's patient-centered. And then from there, depending on if they really want that chance for cure, and they're a little bit borderline, then I might start, for example, with like our mini chop and then go up to full dose R chop. Because my goal is always, as you suggested, is cure. And so I really want to make sure that the patients get all 6 cycles of chemotherapy in. And I would hate for them to get, some sort of toxicity that puts them in the hospital and delays chemotherapy by a couple weeks, and then I don't end up getting the 6 cycles in because there were too many side effects. So I balance that, and I always look to my colleagues too. I talk to my colleagues. I ask them, based on your experience, what are your thoughts? We do fortunately have a large population of older adults here in Phoenix, and so I'm able to, get a really good assessment from my colleagues as well.